morbidity and mortality in Black males in this community. So we're happy to have all of you here, and happy to have Devin's parents here as well. They'll share their story. We wanted to this be an enlightening moment, opportunity to learn more about overall health. So bring up some of the partners that we worked with. This is my brother Sean right here, and Shahidra, his wife Shahidra. I'm sorry. Come on up.
Hey, what's going on? I just want to say thank you for everybody here. Thank you to the panelists. We truly appreciate it. And also, this meant a lot to me, being able to assist with the planning, because Devin was my chapter brother, and I had the opportunity to get to know this very intelligent, smart, creative young brother. So it really means a lot to me. And I just want to say thank you for trusting us. And I feel like you'll be very pleased.
Perfect. And we are very excited and honored to be able to help sponsor the symposium. We have a nonprofit called Strong Family Wellness. So we run a wellness weekend every year. This year, we happen to be running it in conjunction with the district meetings. So that's why you see all the people in the lobby. They are here for 3 days of exercise, but also 3 days of showing our community what health and wellness looks like. To Sean's point, Devin was very important to us. Our oldest son looked up to him like an older brother. So he was a phenomenal young man. And one of the things with health is you never know who you're inspiring by what you're doing, no matter how old you are. So we are excited to be sponsors and hope that you find this conversation lucrative, but you also take away some good stuff. Oh, and the next person you will hear is Lucas Tyndall of Lucas Live Media. He will be our moderator for this evening. He is a local here in Canton, but he is not local to everybody. He is more, we could say, international, or, all the things. He's fantastic. So I hope that you enjoy him, as well as our speakers tonight. Thank you, guys.
Thank you. Thank you. Excited to be here with you guys again. As I said, my name is Lucas Tyndall. I'm wondering why we don't have stairs to the stage. I'm gonna need a doctor before this thing is over. My knee hurts. It's gonna be okay. We're talking about some very important topics tonight, but in that, we want to just have a genuine conversation, right? We're not leaving here sad, right? We're gonna leave here empowered and grateful and having learned something. And I'm gonna introduce you to these wonderful parents here in just a second. I got a moment to speak to them. And we talked about the fact that their son was 22 when he passed, and I have a 22-year-old son who is running around playing basketball every chance he gets. And he tore his ACL many years ago, and I said, okay, now he's gonna sit down. And he jumped up and did even more, right? So we're gonna learn how we can keep our families healthy, our kids healthy, and ourselves healthy, okay? And as a Black man myself, and this is not just about Black men specifically, but we are gonna highlight that quite a bit, I'm not trying to go to the doctor, okay? I know my doctor. I don't mind running into him every now and again, but I'm like, I don't need to go yet. And then they scare you with all the tests you're gonna have to get, and I'm like, I don't know about that. I saw something on TikTok that said that's bad, right? So, but we're gonna break through those myths. We're gonna talk about cancer, mental health, obviously heart disease, and we're gonna leave here empowered today, okay? All right, at this moment, I want you guys to welcome to the stage the parents of our honoree, Devin Moore, Krista Poole, and Daryl Moore.
Thank you. Thank you. I want to start by saying thank you all for being here tonight and being a part of this program. Thank you to Omega Psi Phi Fraternity Incorporated for helping to honor Devin and his life, his legacy, and helping to really shape his legacy with these programs annually. So thank you for allowing us the space to share our story, to hopefully help inspire, but also to help prevent sudden cardiac arrest from taking lives. So I just want to maybe talk about Devin and our story a little bit, and then I'll hand it off to Daryl to talk about the program and kind of why we're doing what we're doing. So our son Devin died at the age of 22, December 6, 2017. He was in the prime of his life, attending college, a senior, looking forward to all of the things that, a young man who's seemingly healthy would look forward to, graduation, a career, family, hopefully in the future. And his life was unfortunately cut short. When, as a parent, you want to do everything that you can to protect your child. And so you do what you can to keep them healthy. Devin was an athlete most of his life. He played basketball, t-ball, baseball, flag football, tackle football. He did everything. By high school, he was very focused on basketball. We traveled across the nation to watch him play. And again, we thought he was healthy. I worked in healthcare I still work in healthcare for over 20 years and always had access to the best doctors, insurance. So access was not an issue. Devin and our daughter, went to see their doctor every year for annual physicals. Each time he played a sport, he would have a physical. And so we thought we were doing everything that we needed to do. Reflecting on his growing up and the care that we experienced, we didn't talk a lot about heart health. If there weren't symptoms or issues, we just weren't talking about his heart. We talked a lot about his asthma because he did have a chronic condition from a very young age. And so I think when we learned about what caused his sudden arrest, we were shocked, confused, didn't know, how this could happen. They actually, after an autopsy, determined that he had a condition called hypertrophic cardiomyopathy. It's where the heart thickens and can become erratic and causes sudden death, essentially. And so what we learned is that the condition that he had, it can often go undetected through routine physicals. So you can't hear it by listening with a stethoscope. And you have to really do an EKG or other extensive tests like an MRI. And these tests are done. They're done more frequently now. Schools offer them. But as a parent, you don't know that your child needs one because, they look healthy, they're seemingly healthy. And so one of the reasons that we established the Devin Moore Heart Foundation is to increase awareness. And so in your communities, when you know that these screenings are offered, don't kind of think, oh, I don't need to do that because my doctor's not recommending it, or it's not something that could happen to me, because it happens. Unfortunately, it happened to us. And to know that there was potentially something that could have detected it early and could have saved Devin's life. Hindsight is always 20/20, and we can't change what happened, but hopefully we can change someone else's life and prevent it from happening to them. And so our foundation, we do promote screenings and heart health and prevention, but we also want to call to action and encourage people to learn CPR, to learn how to use an AED. These are life-saving interventions. So if it does happen, you can jump in and potentially help. Most of these situations that we hear about when athletes drop, it's in a public setting. But I read a couple days ago that I think 7 out of 10 sudden cardiac deaths occur in private homes. And so, it could be a family member. It could be a heart attack, maybe not sudden cardiac arrest, which is different. So that's the other call to action, is to, really arm yourself with learning how to do CPR, skills that could save someone's life, someone you love, someone you work with, just really important. So I'm going to turn it over to Daryl and have him share a little bit about the foundation and kind of how we partner with the fraternity.
Good evening. And first, I would just like to say, God is great. And just bear with me. No, but just man, Ronnie just asked me how to deal with it. It's emotions always come, but I've learned that it's okay. But to go back on the history, I had to start from the beginning. When Devin had passed, and I walked down the lobby. The first call I received was from Brother Bobby Robinson. And he prayed with me on the phone, and he said, man, we're going to make sure his legacy live on. And, still going through processing things. And me and Krista spoke shortly thereafter. We're going to donate everything that we could, bone, skin, eye tissue, everything that could be donated. we were willing to do it, and we gave them the okay to do it. And so moving forward, so I get another call from Brother Walter Madison, and he said, Mo, I love you, bruh. And he said, but this could be bigger than what you would ever think, bruh. I want y'all to think about an endowment. And, it just came on, and me and Krista got to talking, and brought Brother Bobby Robinson back into the conversation, as well as Lamar Cole. And we got a call from the grand bosses at the time, Brother Knox, and we're at a district meeting, and Brother Bobby pulled me out the meeting, and he said, how much short are you guys for the endowment? And we called Krista, and she found out, and Brother Grand made it happen for the first part of the endowment. Okay. Fast forward, it's funded twice over now. And 2 kids get a scholarship every semester at Kent State University. Okay? 2 kids. Moving forward, Krista felt that we need to do more, within the community as she was speaking. And it's hard to come behind her, as you see. Normally I get mine in and let her close it. And so, yeah. So so she said we need to do more. She wants to do more. And so we founded the Devin Moore Heart Foundation, where she explained to you how we go in the community and have CPR training, and we donate AED machines and screenings as well. Well, I recall when she said, well, I want some of these schools to start this screening. And I don't want to say the hospitals, but if you were under one hospital, your school wasn't doing it. If you was under another one, they were doing it. And just so happened the school that Devin had attended, Beechwood High School, they wasn't doing the screening, and they had the money to do it. And Chris and I went to a school board meeting, and she was determined, as well as I, to speak to the superintendent, and no, the president of the school board, and as well as the superintendent. And so he was having a conversation, and he knew what we were there for. And he tried his best not to have a conversation with us. But Miss Poole got a lot of bulldog in her. She got a little bull. She said, we're not leaving. I said, no, I'm with you. So we sat there patiently, let him finish about 4 or 5 different conversations. And we just kept easing up and easing up closer to him. You have to see us. So to make a long story short, they now do the screening. She stayed on them. Now they do the screening. Okay? I need to share another little story too. And it just came back to me. Through the screening, through the Devin Moore Heart Foundation, we went to Ginn Academy. And we did the screening and CPR training, and we had donated an AED machine to the school and to the athletic program. And through that screening, we found out that one of my closest friends' son had a heart issue. And man, that was right here, Sean, his son. And to show you how good God is, and he's in the blessing business. And so, from the donating, body parts and tissue and skin, to the scholarship, to saving lives, to the ADs, Devin has been a blessing to many, too many. So I just, I want to, I want to thank Krista. She, she's been strong through this, sometimes stronger than me, you know. And, I have to thank Brother Bobby Robinson, who, he tipped this thing off. I have to go back to Lamar and Brother Walter Madison and in the 4th District who adopted this, I got a call just the other day that they may be seeking to have this at our international meeting in Cincinnati. Okay, so Devin is reaching. Devin is still working. And that was the kid he was. So I just want to thank each and every one of you guys who came out to get educated. Trust me, Mr. Tyndale. When Mr. Tyndale said you're going to leave here with something, something good. Last year was phenomenal. The year before that was it's just been growing and growing and growing. So just sit back and trust me, you're going to really feel something and get something good out of this. All right, thank you.
And before we end, if you want to give back and help support us, please consider donating to the Devin Moore Heart Foundation. It helps us continue to make an impact in the community. So thank you. QR code, direct to the website. Thank you.
Thank you, Deb. Wonderful, wonderful. We are grateful to have them here in the building to share with us. I know most of us, if you're a parent or grandparent, clap right now. Clap. And I know for most of us, what they're talking to us about is each and every one of our worst nightmare. I know it's mine. I'll tell my kids, y'all better not be running around here acting. They grown. I'd be like, y'all better sit down somewhere. Calling me, and young people will be young people. And their son, he's just playing basketball, and something happens to him. So today, again, my goal, when Shauna, Shahidra, and Donnie, they reached out to me about moderating. One thing about me is we can talk about serious things, but we're gonna have some fun. Is that okay? Is that odd? Is that strange? I was raised that way. We laugh through poverty. We laugh through struggle. We laugh, you too? We laugh through some stuff. We be like, we don't have nothing to eat. Well, I guess we're gonna eat laughter because it's all we got. Okay, we just gonna have a good time tonight. So I wanna welcome to the stage our wonderful panelists. If you all wanna come up, we're gonna let each of them introduce themselves. We ready for our panelists?
Yes, we're ready for the panelists.
Okay.
We'll make sure we have the seating correct. This is what we're gonna do, panelists. We got this seating arrangement. They didn't have any on lower chairs. We're gonna have the people with experience sit right here.
Did he just call half of our panelists old? Wait a minute. There's some seniority seasoning going on here. I don't know. Now they got to self-identify and stuff. Now they go, I'm taking a high chair. They're not going to call me old up in here. My knees work on chairs. That's not right. Now they fighting over this. Okay. What we going to do? All right. Do we have is someone missing? Do we have everybody? Oh, here we are. Okay. Yes. Yes. What age group would you like to be in at this point? It is all. So let's give a hand to our panelists here today. We're going to go down the line. And we're going to have each of them introduce themselves. Many of you I met before. For those of you who I didn't, again, my name is Lucas Tyndale. It is my pleasure here today to be your moderator. My goal is to just ask you questions. If you don't like the question, just make something up. We don't know. No, I'm just kidding. No, we were like, we should eat Captain Crunch. I guess so. That's what he said. I don't know. But share with us from your heart what you think matters most from the question you receive, and give us something that we can take home. And everybody out there, what you guys have to be careful of doing, this happens in church. We go to church and the pastor's preaching, and the whole time we're thinking about all the other people who should have been here. Man, if my sister was here with her crazy self, man, if my cousin was here, man, my dad need to go see the doctor. It's about time. Knowing we about the same age. We ain't but 20 years younger, and we need to go too. So take this. You know how they say don't take something personal? Everybody say, I'm taking this personally. Take it personally today. Take it personally so that you can impact your life and the life of the people around you. We'll start here.
Hi, I'm Dr. Daniel Suffolk. I'm a radiation oncologist, so a cancer doctor that uses the radiation for treatment.
I'm Atal Qureshi. I'm a cardiologist that deals with heart failure, weak heart muscle, or other things related to those kind of things.
I'm Latoya Dickens-Jones. I'm a family nurse practitioner.
I'm Dr. David Davis, family practitioner.
I'm Brian Simmons. I'm a cardiologist. Been working around here. Well, I'm in the old man's chair. So quite a while.
I got the. You're right. He's seasoned.
I'm Calvin Felder, marriage and family therapist, 35 years in the field. I work with families, individuals, and children too as well. Currently, my specialty is men's issues.
Love that. Love that. One more hand for this wonderful, distinguished panel here today. Now, they gave me the questions, and they gave me this cute little seating chart. You probably can't see it. They gave me this cute, do I need a new mic? Okay, someone needs a new mic. All right, Danny in the back. Shout out to Danny Williams on my team, the Lucas Live Media team. She's pointing at someone who needs a new mic. All right. Yeah. She said, my mic seemed healthy. See, that's why we got to know. We got to check. You got to check. You never know. All right, so I'm going to kind of jump around a little bit. If I ask a question and someone else answers it, and you think, I got something I want to share on that, just let me know. Jump in there and let's all talk, okay? So we're going to start, Dr. Simmons. Our first question for you is, what are the earliest warning signs of heart disease in Black men that often get overlooked or dismissed?
Yeah, I noticed that question. I don't have an answer, to be honest with you.
Mhm.
I think basically people present the same way. However, sometimes it can be subtle or it can be really severe. One of the things that happens is people start feeling chest discomfort, but it's not chest pain like you see on TV.
It's not an elephant on my chest every
It's
time?
not an elephant on your chest. It's mild. It might be mild tightness, mild non-descriptive discomfort. People sometimes present with shortness of breath. When you think about people who have been active, let's say, especially you mentioned young men, they have been active. Last year, they could run a half a mile. But this year, suddenly he can't run a block, or you can't run a block, or you can't do the work you used to do 6 months ago. You need to start thinking then maybe there's something wrong. You need to understand your own body. There's no magic to this.
Yeah.
But you have to be cognizant and educated about what things could be going wrong. For instance, you could be having irregular heartbeats. You could be having, and they may be subtle at the point, but if you don't go to a physician to see if there's a major problem or no problem, you need to know. And a lot of times, we're all human beings. Put your head in the sand,
Yes.
say, hopefully it's going to go away. I've done that myself. Sometimes it does, but you don't want to be there when it doesn't.
Yes. Thank you so much. Excellent, excellent answer. Yes, please feel free to give him a round of applause. You don't have to applaud after everyone, but if you like it, clap. I mean, we're not going to be mad at you. I think that is wonderful. I don't know. I'm going to look around the room and I'm just going to guess. Blink twice if you've ever buried your head in the sand because you had a little something going on and you was like, I think I'll be okay. I don't need to breathe that much today, right? I think I'll be okay. And we push it off and push it off and push it off. And one quick follow-up question for you. I know one thing that I do that I'm not sure that it's the right thing to do is I'll go online and I'll start looking up what is going on. And usually they're like, it's over for you, buddy. It's like, start planning your funeral. I'm like, man, WebMD, I don't think I want to talk to you anymore. So definitely not asking. So if you don't mind, Dr. Simmons, what is your thought on that? I mean, there's information there. I don't know. I mean,
there's information.
Yeah.
But is it the right information?
Okay. All right.
And I don't think there's never anything wrong with trying to gain as much information as you can. I have looked this new chat GPT
Yes.
seems to, it's not that bad.
Yeah.
They have at least good answers,
Mm-hmm.
but again, you might want to discuss if you've got a problem.
Yeah.
You can give it a little time to see if it'll go away.
Yeah.
Because the human body has a remarkable adaptation of curing itself.
Mm-hmm.
But if it doesn't go away, or it seems to be whatever it is, gets worse, and it doesn't have to be a heart, it could be anything,
right,
then you might want to seek some other knowledge.
Love that. Love that. Thank you so much. Our next question, is it Qureshi?
Yeah.
Okay. Dr. Qureshi, what are the most common heart conditions you're treating in Black male patients right now, and how serious are they by the time you see them?
So I'm an advanced heart failure doctor. So a lot of patients that I see, African American, they have heart failure, and a lot of them have weak hearts, really weak, like less than 20% squeezing function. Normal squeezing function of the heart on an echocardiogram, which is a picture, is between 50 to 70%. So so I see a lot of that. I see a lot of hypertensive heart disease. Blood pressure is running high, has been high forever.
Are these older? When you say the heart is working at 20%, is that what you said?
Yeah.
Are these young people like we're talking about, or is this usually at a certain age?
Could be variable age. I mean, I think certainly I would say middle age, like between like roughly around 50 plus minus 10 years is a common age for us to see this. 60, 70, 50 to 70 year range, I think. Certainly, I mean, what affects the rest of human beings also affects the African American population, like blockages or atrial fibrillation or regular heartbeat. There's certainly unique aspects to African Americans that they do have a little bit higher incidence of hypertensive heart disease, and data does suggest that increased incidence of heart failure in general. Specific question to me was, what are you treating? And I think the answer to that is they end up percolating down the system, and then they end up coming to my clinic where they have a really weak heart, and I end up seeing a lot of that. The good news is a lot of them do end up getting better or recover their ejection fraction completely, especially if it's not related to blockages.
Interesting.
So if they do have a blockage and a bunch of heart muscle died and there's a scar tissue, then we cannot replace that. But short of it, it's a very optimistic looking scenario with medications and devices that we have. The hearts tend to recover.
That's absolutely great news. I think when you said 20%, heart working at 20%, was anybody else kind of surprised at that number to think 20%? That doesn't sound like hardly strong enough. But you're saying it is not to say that at 20%, this is where you are for life.
No. Yeah, so that's why I tell my patients, like, if I put myself in your shoes for a second, I'll be like, gosh, I'm going to die. What the heck? What is going to happen to my kids? But yeah, some of them do die. I mean, there's a 95% chance that we're dealing with severe heart failure. That even those 95% of them may just follow the book, and they may get better or improve to a point that they can live for years and decades. There is certainly a 5% population that may need advanced therapies like transplantation or heart pumps and so on and so forth. But medications are really quite impactful. And when combined with certain pacemakers of certain things, it does become a pretty meaningful, impactful thing. So yeah, if you look at advanced heart failure, which is a subtype of heart failure where things are more advanced, like very weak, less than 20%, whatever, the mortality of it, if it is not treated properly, could be like pancreatic cancer. It could be pretty bad, 6 months mortality or even less. Like you can even make it to a few months, maybe if not even a few days, few weeks sometimes. But the thing is that in a lot of these patients, there is an option of doing something. So the difference between a cancer and this would be like, I'm sure you can do radiation therapy and everything and chemo and so on and so forth, but they may not make it. But in this kind of situation, they may actually make it. They get their life back.
Yeah.
They can go play with the grandkid and may live for years. So certainly there is always going to be nuances of people that may not do well and may have other limitations that we can offer these things. But yeah.
Absolutely. Wonderful, wonderful, wonderful. Obviously, heart health is a big topic today.
Can I just?
Yes, sir, please.
And when Dr. Qureshi mentioned 20%, what you want to know, though, is that the average heart function is about a little over 50%.
Okay.
So we don't want to think in terms of 0 versus 100%.
That's definitely what I was thinking. And it made my heart pound. And I was like, uh-oh, they're going to have to help me. Okay. 20 still not good. Okay, and thank you. And she chimes in and says, okay, don't start feeling good with your 20 self, with your 20% shooting percentage. That's not, it's not a good batting average and it's not good. Okay, I got it. Okay. Yes, well, thank you so much. So average is about 50. Oh,
50 and above.
50 and above, okay.
Yeah.
50 to 100. Now, come on now. Is it 50? Okay.
Rarely would you see 100%.
Okay.
Sometimes that makes you get worse.
Interesting. It's going too hard. Interesting.
Remember, we're talking about a pump and it's a machine.
Yes.
So we want to make it work
Efficiently. Yes. Excellent. Excellent. Heart health obviously is very big. Yes, sir.
I'm just a little family doctor. I'm not,
but these families all have hearts as well, though.
contemporaries. I look at, I watch people's.
If you could hold your mic up a little bit, we
watch
get it for the
people's
live
body
stream.
language, and it's like you guys are listening, but like the words and the numbers. What they're talking about is when your heart pumps, how much blood it ejects to the rest of your body. Okay, so when your heart beats, that 50% makes everything work fine, and then now it's 20%. So you think about how much blood is not being pumped to your brain, to your kidneys, to your liver, etc. Okay, so just I'm a little different probably than most folks. So I want to, when I see you guys have blank looks and everything, that is what they're talking about when they're talking about your heart. It's not just your heart just pump. It's about how much blood is actually going out into the body. Okay, especially for young guys. I know you like, man, why are they talking about this? Because this has nothing to do with me. Believe me, it does.
Yeah.
And so be real conscious in what you're thinking and what you're hearing, because it's a real thing in young people also.
Excellent. Thank you. Thank you so much for sharing that. And as a family doctor, it's funny you said that we're talking to cardiologists. It's like, well, you want to know that their hearts are good too. They don't get to them until they come to you, right?
That would be true.
Right. So they come to you all. Yes, come to you all, and then you see that something's not quite right, and then we get to the specialist. Dr. Davis, you brought yourself to the stage. I'm grateful for that. So I'm going to ask you a question. Your specialty is cancer.
No.
No, I'm sorry. You're a family doctor. We talked about that. I'm sorry. But are you seeing a lot of cancer in families and people who you're treating?
Yes. One of the things that I would say, especially with this audience, when they talk about disparities in health, because I think someone mentioned that earlier on, we as minorities get cancer and other diseases as prevalent as any. The problem is we don't get diagnosed until later on, because we have a tendency of not wanting to go to the physician, bury our head in the sand.
Yes.
It'll go away or whatever. Because when it was said that, something may change, if you can run and not run, if you're working all day and you're moving, and 2 years ago you were good, but now all of a sudden, man, I'm just getting tired all the time. Now I'm working half a day. I'm just tired. That's a change that you should bring to your doctor. Okay? Because it's those subtle things that's the beginning, or possibly could be the beginning of something a little bit more serious. So to answer your question in relation to cancer, I see a lot of prostate cancer because that's what we get.
Are you seeing it because they're getting screened and that's how you find out, or there's other symptoms that are causing you to change?
I'm a big screener.
Okay.
I'm a huge screener. That and breast cancer and colon cancer. Those are the things that I screen more so than anything. So
you're pushing your patients. You're saying we got to do this at this point. I really would like to see you.
Probably a little bit more of a tyrant, so they don't have an option.
Okay, I was trying to be gentle. I was like, you're a pusher. He's like, no, I don't play.
Because I'll tell someone in a heartbeat, if you don't want this screening that could possibly save your life, if something happens to you, I don't want that on my conscience.
Right.
Because I take it personal.
Yeah.
If you're part of my group, then you're part of my family. I take it personal. So screening is not really an option for me with my patients. Yeah. And I think we have a good relationship where, I can get away with that. So I do diagnose quite a bit.
Yeah. Interesting. And I would say, first of all, thank you for doing that. And to those of us who are pushing back against the screenings, what would you say to us? Because you have a relationship that you can, you have relational equity with your people. So you can cash in on the relationship you've built and say, I have an ask of you and it's for your own good. And they'll say, I trust you because you've been good to me all this time and I'll do what you asked me to do. Everybody does not have that relationship with their doctor. Their doctor says something, they think, and the last time you told me to do something, I don't necessarily know if I can trust you. What is your take on that, though? Because our lack of trust in the medical system or our doctors could be harming us.
That's a simple question. Answer. Get a new doctor.
That's a good.
That's get someone that you trust. Why would you go to someone that you don't trust? You're paying someone that you don't trust. That makes no sense.
Interesting. So
you find someone that you trust and that you believe in, and through time, you'll get that relationship.
Yeah. I think that's very important. Let's give a hand to that. I think that is very important that we find doctors that we trust. There's something called the sunk cost fallacy, right? The sunk cost fallacy says, I've put too much time into a thing to change the thing. So people stay in relationships, they be like, I don't like them no more than I like anybody. I don't like them at all. But we've been together so long, we've been together 20 long, miserable years. And I'm going to stick it out. We're going to be on the porch, rocking and arguing, right? So it's the sunk cost fallacy, the idea that I've been with this doctor for so long now. I mean, I don't even know how another doctor would even know anything about me. I mean, they're going to look at my charts. Are they even going to know me? If you don't feel that level of trust with your doctor, you need to get a new doctor. If you don't have a primary care physician, we got to look into that too, because I'm assuming that there's some issues with that in our communities as well. All right. We're going to go to Miss Dickens Jones. Question for you is, what does whole person care look like in real life? And how can patients advocate for coordinated care between primary care physicians, specialists, and behavioral health? So we're talking about whole care, and then how do you coordinate all of that?
So whole care to me is physical, mental, and spiritual. So it doesn't matter if you're Christian, Buddhist, whatever your spirituality is. It's all of those things tied up together. So with the electronic medical records, I've actually been able to close some of those loops. So before, I feel like with paper, we were begging for stuff, but now like we're kind of talking to each other. So like if I have a patient that sees Dr. Crushy, I actually get a report from him within 24 hours.
Wow.
Or if I don't, I'll have the patient sign an ROI so I can actually get the result. So that aspect, if you're a good provider, you're going to close the loop for your patient. Yes. Instead of saying, oh, well, I don't know what
I don't know where they went.
I guess I don't need to know what they did. And a lot of the mental health providers, they also will kind of CC you on the note. So that's a good thing. It ties everything together.
I love that. You said spiritual health. I know often in the Black community, we have a lot of strong spiritual beliefs. And a lot of us believe the Lord will fix it. And is that true? I don't know if y'all ever heard that. That's right. The Lord gonna work it out. I don't need to see no doctor. I'm going to see pastor. He's gonna pray over me and I'm gonna go lay down.
But maybe
right?
the Lord will send you to me.
Okay.
Get you to the right people.
Okay. All right.
Yes. Yes.
Okay. So talk about that. So you're saying don't deny that the potential that God is trying to get you to a person who can help you as opposed to a miracle.
Correct. Yes. I would definitely agree with that. And like you're saying, like, you have to trust your provider. I get so many people through word of mouth. Like I don't advertise, I don't do anything. So these people are like, well, you see my neighbor and you see my goddaughter and you see my this person. And they come to me just because a person, their family trusts me. So that is huge, just getting trust from people.
Yeah. I love that. I love that. And so let's take that personal, everybody. As we speak, our producer in the back is saying, hold those mics up because the people online aren't going to be able to hear us and they're going to be mad at her. All right. Thank you so much, Danny. So as we think about that spiritual health, let's make sure we are not denying. I always say we pray to God for miracles while not doing the practical. I'm looking for a miracle and God is like, go to the doctor I gave you. Could that not be the blessing? Remember your goddaughter or whoever mentioned this lovely lady who would take care of you, and you could at least reach out and see if she can take a new patient. Try something. So I think that's very important because a part of it is I think we can easily deny reality based on a false sense of spirituality. And we can find ourselves in bad situations. So I believe these doctors here and this team here of medical professionals are going to help us look at that. Dr. Felder, we're talking about mental health now. As we look at this, question for you is, how do you screen for depression, anxiety, substance use, chronic stress in your patients? and managing cardiac disease. So can you see a tie between? I didn't write these questions. That's like a 6-line question. So supercalifragilistic. Okay. So let's go back a step. So screening. People come in. People are, we grew up. I know in the Black community, like I ain't crazy. I ain't crazy. I don't even need to go see no mental doctor. That's for crazy people. Meanwhile, every day we like, you're driving me crazy. Every day we tell our kids, I'm going crazy. Then somebody's like, you might need some help. I ain't crazy. All right. So help us with that. Well, how do you help people with it? How do you diagnose it? Kind of just give us a touch in from your perspective and what you're seeing with mental health.
Well, one of the things that I do is I screen daily. As I meet with my clients, I'm always checking their mental health status. I'm looking for things. I'm looking for something that is indicating that there is a sense of depression, that there is a sense of anxiety, that there is a sense of some kind of foreboding feeling that they may be going through. So I'm going to ask you about, how was your work today? I'm going to ask you about, how was your family doing? How was this event doing? I'm going to continue to screen just in my general questions, because I want to see if you are still going to be engaged with your family, or have you become isolated? Have you started to shut down? I'm going to gauge if your anxiety is up, because you're a little more on edge, you're a little more irritable. I'm going to ask you if you slept well tonight. Oh yeah, I get a lot of sleep. But how much sleep you get? I get about a good 4 hours. Mm-hmm. No. We know that's not good. Okay, well I got 8. But I was up at 2 o'clock. I was up at 3 o'clock. So I'm gauging every day. And if I should happen to have a sense that there may be something there, I'm going to put a screener in front of you. And if a lot of people haven't noticed, there's a screening for depression when you see anybody up here. We now as a medical community have integrated the PHQ-2, which is a simple 2-question screener that any of the medical professionals can use to indicate, hey, I'm going to send you to Mr. Felder. I'm going to have you see somebody. And then I will continue to screen for you. But the number one screener is right next to you and sitting right behind you. They're the first ones that are going to notice something's different. Mm-hmm. Something's off. He just gave away his favorite line shirt. He's never gave that away. He just got some very terrible news that his life could end soon. He seems really strangely at peace. Is he going through depression? Has he made a decision to take matters into his own hands? I see you up at the spot all the time, drinking. I see you up there acting out of pocket. You acting really strange. I don't recognize you no more. You're always angry, always irritable. The first screener is the one sitting right next to you, the ones you go home to, the ones you work with, the ones you call friends and family.
Excellent. Thank you so much for that. A follow-up question to that is, for those of us who may know someone who seems to be acting differently, right? And I think we all tend to say, I don't want to judge. I know what it's like. Yeah, they stressed. Everybody's stressed. I mean, look at the gas prices. It stressed me out every time. And then they got the nerve to ask me, do I want to make a donation at the gas pump? I mean, like, do y'all ever give donations? So anyway, so we find ourselves under a lot of stress, right? The world is stressful. The news is stressful. Our country is stressful. There's so much going on. So first, I think sometimes it's hard to know, like, is this truly stress or just what everybody's going through? So one, kind of how do we try to detect that, or what questions might we ask? And then when people are resistant, what do we do? I'm not, nothing's wrong with me. What would you recommend? Maybe let's go there. What would you recommend we do if someone near us, we're concerned about their mental health and they are very resistant to the fact that anything is wrong?
One of the things that I wanted to answer that question in particular is, what do you do when you feel somebody is maybe going through something? Maybe you see something different. Well, the very thing that you might not want to do is to tell them, you look depressed. You look anxious.
Wow.
You got an anger control problem, because those are going to send off bells. That's going to send off alarms that are going to initiate that stigma reaction that you're talking about. Oh, you're trying to say I'm crazy.
Right.
I'm not doing that. But maybe if we talk to them as we are connected to them, to say things like, hey, you don't look like you're getting a lot of sleep well. I know somebody you can see about that. Or, hey, I noticed that you tend to be shutting down a little bit. You know, look like you're kind of tired. You look like you're kind of worn out. or you look like you're a little more irritable. I know somebody I want you to talk to. Rather than putting up those medical terminology to turn somebody off and send them into that, down that rabbit hole of that stigma, let's just keep it cultural. Let's keep it close, and let's just talk basic. Another thing I will never do, ever do, is I will never challenge your God. I will ask you if you talk to your pastor. Did you pray on this? I may even ask you to bring your Bible with you to my sessions.
Wow.
Let's go through the Bible, because that is one of the, as it was mentioned, body, mind, and spirit all need to be in sync. If any one of those are out, then the other two are not going to be able to make it. And I also want to bring this up because I am a family therapist.
Yes.
You're not going through this by yourself. You're never going to go through it by yourself. Your family is going through it. As you start to withdraw, somebody has to step up to take up your part. As you are missed from family events or functions, somebody is going to notice, and they're going to be acting differently. So when you start getting phone calls from teachers that Ray is not doing well in school, not sitting in his seat, when the missus comes home and she's very, very tired and she has to do something else too as well, or when you're starting to feel like you just don't want to get out of bed, you're not going through this by yourself. Not ever.
Thank you so much. Thank you for saying that. And I would say that I'm sure we felt that before in our lives where I don't know if you'll admit it, but I will, where I didn't want to get out of bed, right? I lost my mom March 2020. I didn't want to get out of bed. For what? Like, I didn't understand. My spirituality was tested. My mental health was tested. Everything was just a strain. And I just didn't know, like, my safety net in life, my person is not here. How am I going to go out there? What if something happens? My safety net is gone.
It's also adherence to the suggestions and the medications that are given to you by these wonderful people up here. If that person is going through depression, they're likely to make a decision or give up, if you will. So the first thing they'll do is stop taking the medication.
Yeah.
The first thing they'll do is talk about the quack that they see. They don't know what they're talking about. So we will see, as depression comes on, we will see an increase in the lack of adherence to medical advice, suggestion, exercising, taking care of yourself. I don't feel like going to church today. I just ain't feeling it, you know? That I don't even like what's going on in the sermon this week. Those type of things you start to see. When they fall off, that's when depression, anxiety is taking place.
As that was just said, I want everybody to think for just a moment if there's anybody in your life that you need to have that difficult conversation with today. And if there is, have that difficult conversation. Talk to them about it. Let them know you care. Let them know you notice that something is different. Okay. Yes.
One of the things we as men have a tendency to say, we'll handle it. It'll be okay. We'll handle it. And we'll bury ourselves into whatever we're doing, or we just don't do anything at all. One of the things that I would say, if it's you, or if it's someone that you know, or if it's someone that you love, ask that person, how are you doing? Take them aside. How you doing? I've been thinking about you. Been on my mind. How are you doing? And lay hands on them, because human touch is something magnificent. If you put a hand on someone's shoulder and say, how are you doing? It becomes real. You know, so if you think that you know someone who's going through something, whatever it may be, ask them, how you doing? I was thinking about you. I appreciate you letting me in that parking space. Brother in the back. I appreciate you letting me in that parking space. You know, how you doing?
Right. It's like, I'm mad. I love it. And when people, there's a concept called double clicking, right? You click on something online, you click again, you go deeper into the website, you go deeper into something. I think so often we ask how you're doing, and number one, we don't mean it. We're really saying hello. You ever ask somebody how you doing? How y'all doing? How y'all doing? and you tell me what's wrong, I'm like, I ain't really mean what's wrong with you. Don't be telling me all your business. Slow down. I don't really care, right? We got to start slowing down and double click. I always ask the next natural question. How are you? Blessed and highly favored. What does that mean? How you doing though? It's like, well, the Lord is good. How are you? I know the Lord is good. How are you? Well, I'm terrible.